Evidence-based practice group 2. One treatment approach that can be used with GYM is multimodal aphasia and goal management training, or MMAT meta. This approach is a meta-cognitive language treatment that was tested in adults with severe Wernicke's aphasia. This treatment emphasizes the awareness of strengths and weaknesses in cognitive linguistic skills to increase functional communication. It does this by focusing on error awareness, naming, and phrase completion. For example, treatment may include activities like go fish, memory, or headbands because it uses specific carrier phrases like do you have, naming tasks for memory, and expressive language skills for headbands. MMAT has 4 phases: 3 days of baseline assessment, 12 treatment days, 1 day of post treatment assessment, and 1 day 1 month later to assess skill maintenance. Goal management training is incorporated into this technique by identifying a goal, breaking down the steps of how to achieve that goal, and by appraising outcomes. This is done through once a week visual feedback sessions that cultivate self-awareness of their successes and errors in communication. In addition to individual sessions, this treatment includes small group sessions that are 2 hours a day, 3 days per week for 4 weeks. In the end, researchers found that these adults had improved naming and discourse skills that were maintained at the 1 month evaluation. They had a significant decrease of aphasia severity, which was also maintained, and they had a decrease of impulsivity.
Another treatment approach that can be used to increase content words is verb network strengthening treatment, or VNEST. VNEST is an intervention designed to enhance word retrieval and sentence level context with potential generalization and overall lexical access improvement. This approach aims to strengthen the activation of semantic verb networks, which are represented as neural networks through repeated activation and use. Clients are given a verb and asked to generate related agents, doers of the action, and patients, which are receivers of the action. So, for example, the verb wash, possible agents could include a mother or janitor, while the patients might be dishes or floors. Clients are asked to generate multiple pairs of agents and patients, as this helps activate and use various verb schemas. Additionally, VNest does not utilize any pictures in treatment. This allows the client to search, activate, and retrieve their own memories, which strengthens the neural networks. Emans et al. 2014 conducted a study which included 11 participants, all with a diagnosis of aphasia. The study found significant improvements in the production of sentences containing both trained and untrained semantically related stimuli. VNS promotes increased lexical retrieval, which allows generalization of sentences, production skills beyond the specific treatment tasks. Furthermore, connected speech shows improvement from pre to post treatment in the percentages of complete utterances, indicating enhanced integration of relevant content words into complex sentence structures.
For GYM's writing difficulties, anagram and copy treatment, or ACT, could be implemented. ACT is a treatment method that targets writing and spelling skills in people with aphasia. It is the first step in a 3-step treatment sequence for aphasic speakers that also are having difficulty with writing or agraphia. ACT is implemented using high-frequency words and meaningful words for the individual, such as names, frequently visited places, previous or current occupations, and highly requested items. The clinician will provide the client with an image of the noun or the verb and state the word. The patient will then be asked to spell the target word. If spelled correctly, they will move on to the next word. If the word is not spelled correctly, the clinician will provide the client with an anagram of the word. The patient will be asked to arrange the letters in the correct order to correctly spell the target word. If errors are still present, the clinician will model the word by correctly arranging the letter tiles. The patient will then be asked to write the spelling of the target word using the model. The 3 times. The clinician will then cover up all models and provide the image again, and the patient will attempt to write the word correctly from memory. As is in his single study design, participants the participant was only able to correctly spell 30 out of the 60 words correctly. After 11 sessions, though, the participant was able to correctly spell all the trained nouns and all the trained verbs. Generalization was also seen with untrained nouns and verbs, as 47 out of 50 untrained nouns were spelled correct and 38 out of 50 untrained verbs were spelled correct. The oral naming of trained nouns and verbs also improved significantly.
So Helen expressed that Jim's quality of life is something that's frequently discussed and asked if her quality of life even matters. So she has experienced a shift in what she needed to do after Jim experienced a stroke, such as more responsibility being placed on her because she lives alone with him, and just a lot of changes in general, which does impact her quality of life. And she can be reassured that her concern is valid and that her role in Jim's life is important and is making an impact. More specifically, Helen could be encouraged to have or continue having social activity based on her current levels of social activity. She could be provided resources about managing stress, so different tools or things associated with that, as well as referring her to mental health therapy services or other support in her area, depending on her interest and what is best for her. And these are our references.